Hi there, this is Dr. John from the Florida Center for Hormones and Wellness, and I want to talk a little bit about thyroid and why in a wellness practice we may approach thyroid a little bit differently than your everyday doctor. I remember when I was a medical student and the first day that I walked into class, they told us, ask the patient what's wrong with them and they will tell you. And what that means is ask them about what their symptoms are and then try to understand what it is and come up with a diagnosis on that. And then you use the labs to kind of confirm where you are. And unfortunately, somehow along the way in the last 20 years or so since I was in medical school, that has been completely turned around where doctors today look at laboratory tests to determine what is wrong. And the case that I see most commonly where that's an issue is in thyroid. And when I'll see someone come in with a multitude of thyroid symptoms and they have gone to their family doctor and they have gotten a lab test and the family doctor says, no, it's not your thyroid. The lab test right here says your thyroid is normal. Well, the problem is that symptoms are more important than a lab test, and people have variable sensitivities to hormones to a degree that sometimes more of a hormone may be necessary in order to provoke a response than would seem to be normal on the lab test. And it's very important to make sure, and the literature does indeed support this, that when you use thyroid as a supplement to treat symptoms, that you will not harm a patient. And for some reason, a lot of everyday doctors don't understand that or haven't really read the articles that support that. But the fact is that thyroid can be used in rather high doses to answer patients who have symptoms rather than just treating a lab test. So the next time a doctor tells you that your thyroid may be too high when you're getting a supplement, ask the question, do I feel better or do I feel worse? Of course, it's always possible to get too much of a good thing and to have what we call excess effects. That is, too much thyroid can provoke certain symptoms such as irritability, anxiousness, tremors, jitteriness, diarrhea, can't sleep, and sometimes heart palpitations. But that doesn't mean that it's dangerous. It just means that either you went a little bit too fast in raising your thyroid, or maybe your body is just a little bit too sensitive. It doesn't mean that something permanent or dangerous is going to happen. And clearly, when you look at the literature from the cardiology world, the ENT world, and the psychiatry world, all of those specialties use very high doses for certain conditions there and get very good results without having any adverse effects. The same can be true when it comes to wellness and the treatment of everyday symptoms, particularly things like fatigue, energy, hair, skin, nails, things like that. Thyroid can be very effective as a supplement when you don't necessarily have a low thyroid in order to get a good result. So following thyroid levels is important to do, but it may not be the guideline in what to do with a particular patient. That is, treat the symptoms, not the lab test. This is Dr. John from the Florida Center for Hormones and Wellness.